welcome to this Facebook Live event, 7 Things Women Should Know About Heart Failure Risk. Over the next 30 minutes, we'll answer 7 questions about what women should know that puts them at risk for heart failure. Please start submitting your questions. It's my pleasure to host this event along with the American Association of Heart Failure Nurses and WomenHeart. I have 3 great panelists with me here today. But first, I'll introduce myself. My name is Ashley Moore Gibbs. I'm a nurse practitioner at Sanger Heart and Vascular Institute in Charlotte, North Carolina. And to my left, I have Cindy Byther. She's the past president of the American Association of Heart Failure Nurses, and she is the chief nurse practitioner at MedStar Washington Hospital Center's Advanced Heart Failure Program. I also have Sister Mama Sonia here with us. She is a WomenHeart champion, and she has a diagnosis of heart failure diagnosed in 2016. We also have Beth Harris, who's the Chief Cardiology Advanced Practice Practitioner, who is working at Emory Healthcare. So I'm going to start with our first question that looks at a topic that we need to be thinking about when we're discussing risk factor reduction. We know that 1 in 4 women in the United States will be diagnosed with heart failure. We know that there's certain risks such as high blood pressure, diabetes, kidney disease, and ethnicity that place some people at higher risk than others. So what we want to share with our audience today is what are those things women can do that can decrease their risk for developing heart failure. So let's move to our first question. What uncommon or unexpected practice can women do to lessen their heart failure risk? And I'll direct these questions to all of you guys, but Cindy, I'll start with you.
I think one of the things that we need to do that's not quite common is things like taking care of ourselves, like things practicing yoga or relaxation in a setting where we're very stressed now in our lives.
You know, and another thing is that diet and exercise are very important, and I think they're not so much uncommon as just forgotten, that you don't just take medications, but you also have to monitor your diet, specifically looking at sodium reduction and watching the types of foods that you eat. Processed foods can be problematic and higher in sodium content. And just exercise, being able to go outside, walk for 30 minutes, do low impact cycling. Those things can make a tremendous difference in protecting yourself against heart failure.
I think you both raise a good point. Although they're not uncommon at all, they're not common in our lives, and I think that's what makes them uncommon. But honestly, those are the things that can make the biggest impact and keep us away from medicines and pills and the things that we really don't want. Something that we can control is diet and exercise. Very good. Sonia, we had another question come in. We know that you were diagnosed with heart failure in 2016. Since that time, what have you done? What changes have you made to try to control your condition?
I think the most important thing is to first know that I do have a heart condition. Many times when we're diagnosed with things, we'll just kind of put it aside. Oh, it was just a minor heart attack. It's nothing. I can keep going. I think the first thing you have to do is acknowledge that you have a challenge and then work with it. Follow what the doctor says. Like the ladies have just mentioned, your diet, your exercise, taking care of yourself. Because women, we tend to do so much other stuff without taking care of ourselves. But number one, I have to acknowledge that there's something going on with me and follow whatever it is I need to do to help me be a better me.
And since you've done that, what has changed? Has it been you take more time for yourself?
Yes, I do. I do. I'm one of those type A personalities who runs, I do 85 million things in one day. And now, instead of doing 85 million one things, I do 80 million things. So I have reduced it, and I'm getting there.
Very good. Thank you. So another question that is in the media a lot. What type of diet lowers risks? What would you recommend to a woman trying to reduce their risk for developing heart failure?
I don't think there's a diet that fits everyone. It's not like it's one-stop shopping. I think you have to find what works for you. There are recommendations and guidelines you can follow, such as avoiding high sugar content or highly salty and processed food. But I'm not sure that there's one out there that has been scientifically studied to show that it's better than the others. But there are hints we get from each diet as what's good. Beth, do you think?
And I agree. A lot of times I tell my patients just to keep it simple. You know, eliminate processed foods. Don't eat out. Sodium contents, if from fast food restaurants and the other sit-down restaurants, they can have up to 5 times the amount of sodium content that a person needs in a day. So just really focusing on going back to cooking your foods at home, fresh vegetables, fresh fruits, even fresh meats, and you season them yourself. We tell our patients that. And also make sure that you drink plenty of water. Obviously in heart failure, you have to limit the amount of water you drink, but making sure that you do those simple, basic things that were done 50, 60 years ago before the proliferation of all these fast food restaurants at every corner. So those are the best things that you can do, and the key is what works for you and what works for your wallet as well, because I may suggest a diet that you can't afford. So then is the diet good? No, because you can't afford to implement it in your life. So just keeping it simple for yourself.
And one thing that my doctor would say, it's not necessarily a diet, it is a lifestyle change. He really advocates plant-based. And that can be, it can be expensive, it can be difficult. I had a friend who just came in from Atlanta last week, and she says she does the Do Me diet. No dairy, no oil, no meat, and no eggs. And that's plant-based. And if you can do that, I'm not saying you can do it overnight. I am not there, but I'm getting there. And if you can do that, I do find that I feel better when I eliminate some of that stuff from my diet.
I think you really have brought an important point up, that it is a lifestyle change. It's something that is there. It's not like an antibiotic. You take it and things are better. This is something you commit to over the course of your life, and that can change the course of your life. So, yeah, I like that, the Do Me diet.
Do me.
I like it. I like it a lot. Our next question. Am I really at risk if I'm young and healthy? Do I need to be concerned about developing heart failure?
You know, I think, although your risk may be lower than others, there's still risk. There's still opportunities, there are viral illnesses that can create and you end up developing heart failure. So although your risk may be lower, you still need to go follow up at your primary care provider's office to get your annual checks, to make sure people are screening your blood pressure, they're screening your labs to make sure that your kidney function is doing well, to make sure your blood sugar is under control. So anything that you can do to mitigate risk is great, but there's no zero risk for anything.
Most people with heart failure are diagnosed, and women especially, over the age of 60, and we know that. But there also are those that are diagnosed when they're younger. So everybody needs to know the symptoms so that you see your physician early. Even if you're young and have these symptoms, it's best to get it checked out so that you can get it taken care of and try to prevent it from becoming worse. And so we can't, just as for breast cancer screening, we don't think it's going to happen in a 20-year-old, but we still ask them to do self-checks. We have to do the same thing for heart failure.
I think when I'm working with patients, you brought up a good point about the lifestyle changes, Sister Mama Sonia, and that it is one of those things that if you take steps now, if you make these changes, then you'll never know what you would have had because it will not happen. So it is controlling weight and watching diet and exercising, those things, simple things. Let's move on to our next question. Heart failure doesn't run in my family. Am I at less than normal risk for developing it? If some family member does, if you don't have a family member that has it, are they going to get it?
There's a stage of heart failure called stage A heart failure, and that is for those that have never had symptoms. Yes, you're at more risk if it runs in your family, but again, it's not zero risk. That they've made stage A heart failure for those that have never had symptoms because we still have to pay attention to things. So you still have to take care of yourself no matter what age you are.
And as the data shows, that hypertension in women is one of the primary causes for heart failure. So although it may not run in your family, who's to say that, undiagnosed hypertension over time can potentiate and risk with the developing of heart failure. So you just don't ever know. And so here again, to reiterate, there is no such thing as zero risk. Yes, your risk may be lower, but still going to the primary care providers, making sure you get your annual checks and your physicals and do wellness for yourself, taking care of yourself, reducing your stress, exercising. All those can help impact and decrease your risk for developing heart failure over time.
And in my heart failure program at the hospital where I work, I take care of many young women that never had a family history and it happened out of the blue. So yes, it can happen.
So, what risk factors are unique to women?
Well, you know, as women, we deal with hormonal changes through menopause. Those things can be a factor in increasing the risk of heart failure. And something as a woman who may have had a baby who developed preeclampsia during a pregnancy, that definitely puts them at a higher risk for developing heart failure. So, I mean, these are things that obviously that, you know, men won't go through, can't have babies. So these are just a couple of things that can put women at higher risk. And I'm sure, Cindy, you probably, with your young population, have some other things that have occurred as well.
Yes, having a baby is not just the preeclampsia like you talked about. That also, you can also have peripartum cardiomyopathy. So that develops in women during their pregnancy, usually anywhere from 3 to 5 months before they deliver or 3 to 5 months after they've delivered. It can be within that spectrum. And that disease happens. We know what makes it higher risk. There are multiple pregnancies, or sometimes it just has to do with your genetic factors, but that puts you at high risk. And now we're seeing that women, because of the newer treatments for breast cancer and the chemotherapies that they get, those people are developing heart failure secondary to the treatments that they're getting. So men may also have breast cancer. I'm not saying that they don't, but we all know that the numbers are much higher in women. And so these are things that we're now discovering and trying to figure out ways to prevent also. If you're going to get chemotherapy to treat breast cancer, what can we do to decrease your risks while you're going through that chemotherapy?
That's good. So, when we're thinking about the stress in life nowadays, we've alluded to that earlier. What are those things that we can do about it? Or is there one thing we can target, or two things that we can target? What can we do to change stress? It's everywhere.
I think one thing that I have learned that works for me, find something that you like to do and do it and practice it. For me, I'm a writer, I'm a poet. I can sit up and write all night, and that can bring down my stress. I like to exercise. Well, okay, I'm on Facebook Live, I'm not gonna lie. I like to attempt to exercise. And like for me, I will not run 2 blocks, but I can walk a mile. So for me, just walking, aimlessly, not, that can be a good way to reduce my stress. But find something that you like. I like yoga. I really do like it. I'm not good at it, but I like it. But don't stress yourself out doing a de-stressor, then you're more stressed out than you were in the beginning. So just find something you like to do and embrace it and just do it and just have fun. And before you know it, you'll be de-stressed.
So Sister Mama Sonia, since you've had your diagnosis of heart failure, have you been able to give up some of the things that you used to think only you could do for your family?
Oh, wow. Okay, yeah. I had to take that S off my chest, that superwoman S, because that's so true. We, what they say in the on the airplane, put the thing on you first before. But yeah, I've had to give up. If I don't do it, and it won't get done, the world is not going to fall off its axis. So yeah, thank you for that. Remind me when I go back home.
Well, I think we have to all remind ourselves of that, because we feel like if we don't do it, nobody's going to do it. Well, somebody else can do it, but we just do it all the time, so we don't give a chance to anybody else to do it. And I think one of the things I think about when I think of that is women tend not to go to their primary care doctor and get their health checks. And they tend to make sure everybody else in the family goes. So they make sure you get to your doctor and you get to your doctor's appointment, but we don't tend to go ourselves. And I think for me, if there's one thing I could stress to the audience and what you can do to prevent heart failure, is you need to take care of yourself first.
Oh, yeah.
I don't know, Beth, do you have anything?
No, I mean self-care, and instead of taking the S off the chest for superwoman, put it back on there for self-care, making sure that you put yourself
That's a
first.
good one.
You know, because one of the things, as you said, we always put other people first. And you know, as a parent myself, and you know, a wife, you know, I'm always making sure that you know my husband and my son are taken care of before I take care of myself. And I've had to make a conscious effort to make sure that I put self first, to make sure that I'm doing those things to de-stress, that I'm exercising, that I'm making a conscious effort to eat better for myself, because at the end of the day, you know, if you're stressed, you know, I may not be here later and they will be here, and things continue to keep moving along. And I think we also have to remember that, as you said, Cindy, you know, somebody else can do the work. Even at, you know, even at work, you know, making sure that you distribute the amount of work equally so that you don't take on that burden on yourself. We don't have to do it all.
You know, one thing to do in the middle of the day, just take time to stop and just breathe. You know, we just, and before you know it, I'm sure the heart, I'm not a medical professional, I'm sure the heart rate goes up. Sometimes just stop and just breathe.
I think one other thing I'd just like to mention quickly is things that we can do to prevent it is some of the habits that we have, like smoking. We need to stop smoking. The use of stimulants, those can be very dangerous and can put your heart at very high risk. Drug abuse and alcohol abuse are other things that can cause heart failure. And we have to take control of those things in our lives. And if we can't do it, then we have to seek help. It's not that people are going to punish you for seeking help. We want to help you so that you don't get the diseases that come with it.
This is very valuable information, and it's hard to do because we have to stop, we have to breathe. So listening to kind of summarizing the things I've heard the last little bit is no one is without risk. As women, we are all at risk for developing heart failure. And to do this, we have to follow up with a primary care provider. We have to take care of ourselves from a physical standpoint, making sure that we're getting health checks and vaccinations, and we know what our blood pressure is and our blood sugar is. And we take in mind the things that may have happened if we've had a pregnancy or if we've been a smoker. We have to think about the risk individual to us, and we have to make it part of our family. So the diets we make, the diets that we prepare for our family, our kids, our parents that may be living with us, it is a family affair. And also finding that thing that makes you more you, that gives you that's your oxygen, whether it's reading or writing or working with children or riding horses or for the adrenaline people jumping out of planes and parachutes, right? What is that thing that you take for yourself that actually it pushes you towards the place you need to go, and you can actually do more once you get to that point. But I think it is stopping and acknowledging that you do have the problem, like you brought up to us, and that following the directions that are not always easy to follow that a provider gives the patient. It's much easier to give the information than it is to receive the information and put it into use. So I often tell patients, if I tell you something that you don't think you can do, let me know and we'll try to find an alternative. Because it's one size doesn't fit all, right? It's kind of like the diet we were discussing. You have to find the diet you can stick with. So the Do Me diet is going to work for some people and not. And integrating things like yoga, Pilates, the things that we know that can make us stronger as we grow older, and minimize our risk for heart failure.
Can I ask one other question? Do you feel like you're able to do an open dialogue with your whoever takes care of you in your heart disease? Is there somebody that you can go and talk to? What do you think? Do you think it would be helpful for someone who's trying to prevent things to actually bring in thoughts and questions, or do you always like being told what to do?
Well, I don't like being told all the time what to do. And I think just meeting you two ladies, if I had someone like you all, because you all are open and, you know, can talk to. There's a woman in my doctor's office that she's just, when she comes in the room, it's a breath of fresh air. And it does help if it's someone in that office. And then, as a Women Heart champion, we go around and we have support groups. We are support for each other. to have someone who's going through that exact same thing or close to it, or even just say that they have a heart event, as we call it, going on, to pick up the phone or get on Facebook or talk to someone who's going through the same thing, that really, really helps it. You know, it's like, I'm not alone, I'm not the only one, and my question is not stupid.
It's a very good point. Beth and Cindy, when you think about the patients over the years and the risk factors that you see, what are those ones that pop up again and again when you're like, I wish I had seen them 5 years before, 10 years before, I wish I could have told them then, and it could have changed what's happening now? What are those things women need to be looking for?
For me, I think the biggest thing is hypertension that wasn't managed. Because, you know, and we label hypertension as a silent killer because many people don't recognize either they have it or they may have a headache and just think that something else is going on. But a lot of times just people having high blood pressure and not knowing it hadn't been followed and it just wasn't controlled better. And so, typically I see a lot of younger patients like that. And it breaks my heart because it's just like you said, like, oh my gosh, if I met you 5 years earlier, I could have got you on a better plan, and you know, we wouldn't be where we are right now. So I think I can't reiterate more than enough. Go see annually a provider just to check in to make sure that things are there. Like I said, you can age appropriate screenings to just be on top of things, and that way when you go annually, if things change, if they shift, then you can start making strides to further reduce your risk and try to prevent these disease, because, you know, heart failure is a disease that, you know, when you're talking about over, you know, 30 million people have it, you know, and in a few more years, you know, even up to 40 million people will have it. That's a lot of people, and you know, and that's just the U.S. So definitely trying to just making sure that you go in and getting those checks done, just to have a relationship. And you know, the key is being open with your patients that you are, because it's a team sport. And I tell my patients all the time, like I said, this doesn't work without you. Yeah. You know, I'm just your guide, but I'm here to support you in going through. So those are key things to make mental notes of.
I agree. I do think hypertension is one of the biggest issues, and trying to get someone to take medications when they don't think they're sick is very hard. And I think that's one of the things that I would really love for the younger generations to see, is that hypertension really is silent. And that blood pressure has been so hard, and your heart has been pushing so hard against that high blood pressure for so many years, that that muscle just gives up and fades. It starts to die because it just can't do it. And the way that things are explained to people, I think, makes a difference. And that's the sad part for us, is that, you know, we see it at the end stage, and that breaks my heart.
So as we start to conclude today's live session, is there anything out there that you would tell a family member, a patient, a friend, a sister, a mother, a cousin, an aunt watching today? What would you tell them when you think about those people that you're close to in your life? What would you tell them right now about heart failure?
It's preventable. You know, like I said, just primary prevention strategies. You know, and there are very few cases that sometimes it's not, but if you are getting flu vaccines, you know, sometimes heart failure can be developed as sort of a viral illness. Anything that you can do to prevent and further reduce your risk is always a help.
And do me, not necessarily the diet. Just take care of me. Take care of who I am, and I think if I take care of me, everything else will fall into place.
I think we have to understand our own bodies. I think it's really key that if you think something's not right, don't ignore it. Please go get an opinion from someone to help you figure out what's going on. Just like people now are being taught to know the signs of stroke and signs of a heart attack, there are signs of heart failure. The shortness of breath, the swelling. We need to teach each other those signs and symptoms so that we go get attention right away, and maybe we can reverse the cause before it's too late.
So as we conclude today, thank you, audience, and thank you, panelists, for sharing your time, your experiences, your knowledge of this disease and the things we can do to prevent it. And for the women out there watching, please know that you can prevent this, that no matter what stage of heart failure you may be, stage A as Cindy referred to, we want to prevent any symptoms from ever happening, that you can do this. You just have to stop, breathe, take a minute, and take care of yourself. And things can fall into place with support systems, with a good provider, with diet and exercise. It's incorporating things in your life that will change your future. So I want to thank you ladies again. You've been very helpful today. I've learned a lot from you guys. And as we conclude, you can see this again on the Facebook Live page at womenheart.org and find more information about this. Thank you.